Hi friends, welcome to the daily tips and tricks in pediatric dentistry. So today's video focuses on the entry of a 6-month child to 1-year child into your dental operatory. Now what you can expect. First thing is to be noted over here is the child would definitely be accompanied by the parents. Now there would be some common chief complaint that I am referring it over here. Those chief complaint would be like at this stage newly erupting deciduous teeth are going to begin, for example the lower central incisors. So there might be erupting teeth issues, for example eruption cyst might be there. Okay, so or we can say the eruption hematoma might be there. So these are some of the complaints that the parents are worried and want to get a remedy or a solution to these. Or there might be teething associated symptoms, for example the child is continuously irritated, there is excessive saliva, how to deal with it. Okay, so you should be aware of. Then there might be other soft issues, for example the candida infections or the fungal infections referred to as oral thrush. Okay, then there might be cleft lip or palate issues that are being referred to or it in any stage. Okay, then there might be the first dental visit just for a routine or regular checkup that the newly erupted teeth are there, so the parents are worried whether they are fine or not. So you have to be aware of all these common chief complaints before you can proceed. Now when we plan to proceed as a pediatric dentist, first thing to be noted over here is that we can begin with a knee to knee examination. Other thing that we can do is we can ask the parents to sit on a dental chair and the child can sit on the parents lap. Okay, use always the gloved hands to examine and do not use any sharp instruments. You can use the mouth mirror in such cases. And you have to carefully examine the oral cavity. Okay, and come to a proper diagnosis. Now when you have examined the oral cavity, and this should be followed according to the chief complaint. Okay, do not go further beyond the chief complaint. Okay, first, and this is to be done as the patient or the child is not very stable. Okay, so after going into this you have to properly see for the management yourself and then discuss this management about every detail about the management, how you are going to proceed with the parents. And one thing to be noted over here is that explain these things in the simple or the layman terms to the parents clearly. And when you have explained the protocol, the management protocol, get the written consent from the parents. This is very important. Okay, after you get the written consent, then you can go for an immediate attention if that issue can be resolved immediately, or schedule a 3-month follow-up for a routine or a regular checkup. Also, one thing to be noted over here is that once the parents, you have done everything and the parents are deciding to leave, you should make a note that you should explain the oral hygiene method at this stage to the parents as the most appropriate methods, as there are minimal teeth, and how to take care of them to prevent any further oral diseases.
Thank you very much.